Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. Today, I'm going to address yet another important utilization of the new immunohistochemical antibody, the H3K27me3, this time in the context of spindle cell sarcomas to support the diagnosis of malignant peripheral nerve sheath tumor. Now, this is a case of a 20-year-old female patient who presented with a T1112 tumor. And as you can see, there is a proliferation of spindle cell tumor with some tendency at whirling arrangement that is really worrisome. Again, some pocketing or nesting, some epithelioid appearance of the tumor cells here, perhaps a couple of mitotic figures as well as apoptosis. Marked pleomorphism is also identified in other areas as well as scattered mitotic activity. Now, some foci displayed myxoidish degeneration in the background with hypocellularity, but you can still appreciate the pleomorphism. So we have like hypercellular and hypocellular areas with the pleomorphism as well as mitosis and areas of necrosis. Now, put together, in addition to the location, this would really give malignant peripheral nerve sheath tumor number one in the differential diagnosis, but of course we have to rule out other spindle cell sarcomas. Now, thinking along the lines of MPNST, we first perform S100, and we know that S100 immunohistochemical stain at best shows focal weak nuclear staining in terms of immune reactivity in MPNST. And because of that, the S100 utility in the malignant peripheral nerve sheath tumor is really limited. Now, synaptophysin can sometimes be positive, as in this case, but most often it is not. And again, it highlights the pleomorphism. Now, what was really useful in this context is the trimethylation histone, in which we see negative staining of the tumor cells in the presence of internal positive control. Remember, we cannot treat the negative stains in general, and in this case, the H3K27 trimethylation in the absence of internal positive control. In order to ensure that our immunohistochemical stain is working properly, we have to have negative tumor cells in the presence of positive internal control, lymphocytes, endothelial cells, or otherwise. So put together the age, the location of the tumor, the immunohistochemical stains, and the support from the histone trimethylation, this would really sum up into the final diagnosis of malignant peripheral nerve sheath tumor. I hope you find this tip useful in your daily practice. Thank you.